Welcome to another segment of Focus on Performance. Today we're going to continue our discussion from the last time regarding your revenue cycle. Physician alignment is one area that will be crucial in transforming your revenue cycle. Whether inpatient or outpatient, the revenue cycle will impact physician compensation, which means you have to include them in any associated initiatives. Bring them into the discussion about charge capture, educate them on the impact of denials and eligibility. Have the physicians side by side as you look at options such as outsourcing in managing the revenue cycle. The management of the physician practice does directly impact all aspects of your revenue cycle and ultimately your cash flow. The old manual models are a thing of the past. Technology is woven into our daily lives and needs to be integrated into the revenue cycle. Now, this does not mean a minimal touch approach of writing off denials in advance. It means using people and technology to limit the denials ahead of time. Accountability will force providers in the business office to work side by side to maximize reimbursements, especially as reform advances. Healthcare reform, ACO, it's all here and it's still advancing. Whether good, bad, or indifferent about it, it doesn't really matter. Today's current economic factors are in some cases crippling providers. Throw in reform and without question a transformation of the current model is needed. Changing from a fee-for-service to accountability is going to impact your cash flow. We believe this transformation is forcing mergers and acquisitions across the spectrum, which will impact both your inpatient and outpatient revenue cycles. For example, if your hospital adds new physician groups to the mix, great, but what does that mean to your existing revenue cycle? Does that mean a best-of-breed or an integrated system approach? And how do you scale the operations to support growth? You have to look at different options. We've all heard the real estate mantra, location, location, location. Well, with your revenue cycle, it's all about cash, cash, cash. Without it, buildings don't get built, physicians don't get paid, and the patient is left looking for care elsewhere. In the end, it's about knowing how to scale the operations to meet the needs of the organization to support financial stability and growth. It's about using business intelligence to monitor performance. None of this means your cash has to be impacted. You just have to know and understand your options. Thank you for joining me today for Focus on Performance. I look forward to seeing you here again soon. In the meantime, contact us today to find out how we can deliver full spectrum financial health to your organization.